Every single day, without realizing it, millions of people with arthritis are eating food that is actively making their condition worse. Not because they are careless, not because they do not care about their health, but because the specific foods that drive the most damaging inflammatory processes in arthritic joints are embedded in the most ordinary, most available, most culturally normalized eating patterns in the developed world, and nobody has sat down with them and explained, specifically and mechanistically, exactly what each of those foods is doing inside their joints every time they eat it. That is what I am going to do today. I am going to walk you through the 7 worst foods for arthritis and inflammation, not as a vague list of things to avoid, but as a specific, mechanistically grounded explanation of exactly why each food makes arthritis worse at the level of the molecules and the joint biology. And for every single one of the 7 worst foods, I am going to give you a specific replacement, something you can eat instead that provides the same satisfaction, the same function in your diet, without the inflammatory consequence that is accelerating your joint damage. Before we go any further, subscribe to this channel right now if you want evidence-based nutrition guidance specifically designed for adults managing arthritis. This is the level of detail and the depth of science that this channel provides every single week. Hit subscribe. Arthritis, inflammation operates through 4 primary molecular mechanisms that dietary choices either activate or suppress: the NF-κB transcription factor pathway that turns on the genes for inflammatory cytokines, the cyclooxygenase enzyme system that produces the prostaglandins and thromboxanes that produce pain and swelling, the NLRP3 inflammasome that generates interleukin-1 beta in response to specific dietary triggers, and the gut microbiome composition that modulates the systemic inflammatory environment. The 7 worst foods for arthritis activate one or more of these pathways in ways that are specific, measurable, and directly damaging to the cartilage and synovial tissue that osteoarthritis and rheumatoid arthritis affect. The first worst food for arthritis and inflammation is refined sugar and high fructose corn syrup, the concentrated added sugars found in soft drinks, sweetened beverages, pastries, commercial desserts, flavored yogurts, sweetened cereals, and the dozens of processed food products where sugar is added under names including dextrose, maltose, cane syrup, and evaporated cane juice. Refined sugar attacks arthritic joints through 3 simultaneous mechanisms. First, fructose produces uric acid as a metabolic byproduct that directly activates the NLRP3 inflammasome in macrophages and synovial cells, triggering the release of interleukin-1 beta, the most potent inflammatory cytokine in arthritis pathology, even in people who do not have gout. Second, high sugar consumption promotes the formation of advanced glycation end products, AGEs, which bind to specific receptors on chondrocytes and synovicytes, activating NF-κB signaling and amplifying the inflammatory cytokine production that degrades cartilage matrix. Third, sugar feeds the pro-inflammatory gut bacteria that shift the microbiome toward a composition associated with systemic inflammation and increased intestinal permeability. Eat This, a landmark study published in the American Journal of Clinical Nutrition following over 100,000 women, found that daily consumption of sugar-sweetened beverages was associated with a significantly higher risk of seropositive rheumatoid arthritis independent of other dietary factors. Eat This instead: fresh dark berries, blueberries, blackberries, tart cherries that provide intense natural sweetness alongside the anthocyanin polyphenols that suppress the same NF-κB pathway that refined sugar activates. Plain Greek yogurt sweetened with a small amount of raw honey. Dark chocolate at 70% cocoa or higher, providing sweetness satisfaction with flavanol polyphenols that reduce inflammatory cytokine production. The second worst food for arthritis and inflammation is refined white flour products: white bread, white pasta, white rice, commercial crackers, pastries, and the ultra-processed snack foods that use refined wheat flour as their primary ingredient. A study published in the journal Nutrients found that dietary glycemic load was significantly associated with serum levels of C-reactive protein and interleukin-6 in adults with osteoarthritis with higher glycemic load meals producing greater post-meal inflammatory cytokine elevation, directly measurable in the bloodstream. Eat This instead: steel-cut oats providing sustained glucose release through their beta-glucan fiber content. Whole grain sourdough bread made with long fermentation that dramatically reduces its glycemic impact. Quinoa and barley as grain alternatives. Sweet potato as a starch substitute whose beta-carotene and anthocyanin content add anti-inflammatory compounds to the carbohydrate satisfaction it provides. The third worst food for arthritis and inflammation is processed red meat: the cured, smoked, and ultra-processed forms including sausages, hot dogs, bacon, deli meats, and commercial meat products preserved with nitrates and nitrites. Processed red meat drives arthritis inflammation through the nitrosamine formation from nitrate preservation that directly activates NF-κB signaling. The heterocyclic amine and advanced glycation end product content among the highest of any commonly consumed food group. A study published in the Annals of the Rheumatic Diseases found that higher consumption of red and processed meat was associated with greater rheumatoid arthritis disease activity and higher inflammatory biomarker levels. Eat this instead: fatty fish 2-3 times per week, salmon, sardines, mackerel, herring, providing EPA and DHA omega-3 fatty acids that shift the joint's inflammatory prostaglandin balance toward resolution. Eggs, legumes, and unprocessed poultry as the least inflammatory protein options for daily consumption. Before we continue, here is your pause. Of the 3 worst foods we have covered so far, refined sugar, refined flour, and processed red meat, which ones are you most regularly consuming? Drop a comment below right now and tell us. Your honesty helps this community understand where the most important dietary changes need to happen. We read every comment. The 4th worst food for arthritis and inflammation is omega-6 vegetable oils, specifically soybean oil, corn oil, sunflower oil, safflower oil, and cottonseed oil, which drive the omega-6 to omega-3 imbalance that is one of the most consistent dietary predictors of arthritis severity in epidemiological research. The omega-6 fatty acid linoleic acid in these oils is converted to arachidonic acid, the direct precursor to the most pro-inflammatory prostaglandins, thromboxanes, and leukotrienes in the arthritis inflammatory cascade. Research published in the journal Inflammation found that reducing dietary omega-6 intake and increasing omega-3 intake significantly reduced inflammatory biomarkers and joint pain scores in patients with rheumatoid arthritis over a 12-week dietary intervention period. Instead, extra virgin olive oil for dressings and low to medium heat cooking, whose oleocontyl polyphenol content directly inhibits COX-2 inflammation through the same mechanism as ibuprofen. Avocado oil for higher heat cooking. The 5th worst food for arthritis and inflammation is alcohol, and specifically the daily or near daily moderate consumption that many adults with arthritis have incorporated into their evening routine. Alcohol is directly metabolized to acetaldehyde, a compound that activates NF-κB signaling and promotes inflammatory cytokine production in joint tissue. Even moderate alcohol consumption elevates uric acid levels through the lactate-mediated competitive inhibition of renal uric acid excretion, activating the same NLRP3 inflammasome pathway that fructose activates. Alcohol disrupts the deep slow-wave sleep architecture, during which growth hormone-mediated cartilage repair and anti-inflammatory resolution occur. A study published in the journal Rheumatology found that even moderate alcohol consumption was associated with higher disease activity scores and elevated inflammatory markers in patients with rheumatoid arthritis. Eat this instead: tart cherry juice in the evening for its melatonin and anthocyanin content. Sparkling water with a splash of pomegranate juice for social situations. Herbal teas: ginger, turmeric, chamomile, providing the warming satisfaction of an evening drink alongside specific anti-inflammatory compounds. The 6th worst food for arthritis and inflammation is dairy products high in saturated fat, specifically full-fat cheese consumed in large portions, butter as a primary cooking fat, and cream-based products as regular dietary staples. Saturated fats activate toll-like receptor for on macrophages, triggering NF-κB inflammatory signaling independent of any other dietary factor. Full-fat dairy products contain arachidonic acid directly in their lipid fraction, providing the omega-6 precursor to inflammatory prostaglandins. The important nuance: fermented dairy products, plain yogurt, kefir, aged cheeses have a more favorable profile because their fermentation modifies the protein structure, reduces inflammatory potential, and adds probiotic bacteria that actively support the anti-inflammatory gut microbiome. Eat this instead: extra virgin olive oil replacing butter in cooking. Plain Greek yogurt replacing sour cream and cream-based sauces. Fermented cheese in moderate portions. Fortified plant-based milks for daily use. The 7th worst food for arthritis and inflammation is ultra-processed food, broadly the category of packaged products industrially manufactured with artificial flavors, colors, emulsifiers, preservatives, and combinations of refined oils, refined flour, and added sugars. Research published in the journal Nutrients found that dietary ultra-processed food consumption was significantly and independently associated with higher serum inflammatory markers, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha in adults with musculoskeletal conditions including arthritis. The emulsifiers found in nearly all processed foods, including carboxymethylcellulose and polysorbate 80, have been shown in research published in the journal Nature to disrupt the mucus layer of the intestinal wall, reduce gut microbiome diversity, and increase intestinal permeability in ways that allow bacterial endotoxins to enter the bloodstream and amplify systemic inflammation. Eat this instead: whole foods in their minimally processed forms, fresh vegetables, fresh fruits, whole grains, legumes, eggs, fresh meat and fish, plain dairy that provide the nutrients, fiber and bioactive compounds that protect joints, while absent the industrial additives, emulsifiers, and refined ingredients that inflame them. The nightshade question deserves direct and honest treatment because the claim that nightshade vegetables worsen arthritis inflammation is one of the most widely circulated dietary myths in arthritis communities. Tomatoes, peppers, eggplant, and potatoes contain alkaloids including solanine that, in very high concentrations in laboratory conditions, have shown some inflammatory activity. However, a systematic review of the available evidence found no consistent evidence that nightshade consumption at normal dietary quantities worsens arthritis symptoms in human populations. Crucially, tomatoes are among the richest dietary sources of lycopene, vitamin C, and beta-carotene, potent antioxidant and anti-inflammatory compounds consistently associated with reduced arthritis risk and severity in epidemiological research. Removing tomatoes from an arthritis patient's diet removes a net anti-inflammatory food. Do not eliminate nightshades unless you have personally and systematically confirmed through an elimination protocol that they specifically worsen your individual symptoms. The artificial sweetener replacement for sugar similarly requires honest discussion. Research published in the journal Nature documented that the most commonly used artificial sweeteners, saccharin, sucralose, and aspartame, significantly disrupt the gut microbiome, producing microbial changes that reduce butyrate-producing bacteria, the gut bacteria, whose short-chain fatty acid production is the primary natural anti-inflammatory signal in the gut-joint axis. Replacing sugar with artificial sweeteners may simply replace one source of microbiome-mediated joint inflammation with another. Treat artificial sweeteners with the same caution as refined sugar in the arthritis context. The cumulative inflammatory burden of the diet is the concept that ties all 7 worst foods together. The adult with arthritis who consumes all 7 worst foods daily is creating a daily inflammatory burden that is far greater than the sum of the 7 foods' individual effects, because the interactions between these dietary drivers compound their harm. The greatest anti-inflammatory benefit from dietary modification comes from replacing all 7 simultaneously with the Mediterranean pattern alternatives that each replacement represents. The benefits compound in proportion to the comprehensiveness of the change, and the research on comprehensive dietary pattern changes in arthritis consistently finds that the most complete improvements in inflammatory markers and clinical outcomes occur when the dietary change is most comprehensive. The complete replacement framework: refined sugar replaced with dark berries, raw honey and dark chocolate. Refined flour replaced with steel-cut oats, whole grain sourdough, quinoa and sweet potato. Processed red meat replaced with fatty fish, eggs, legumes and unprocessed poultry. Omega-6 vegetable oils replaced with extra virgin olive oil and avocado oil. Alcohol replaced with tart cherry juice, sparkling water with pomegranate and herbal teas. High saturated fat dairy replaced with Greek yogurt, fermented cheese in moderation, and olive oil for cooking. Ultra-processed foods replaced broadly with the whole food Mediterranean pattern. This is not a deprivation diet. It is a substitution strategy, one that replaces the inflammatory inputs that arthritic joints cannot afford with the anti-inflammatory alternatives that provide equivalent satisfaction, while fundamentally changing the biochemical environment in which your joints operate every single day. Your joints respond to what you eat. Every meal is either adding to the inflammatory burden, they are managing, or reducing it. You now know exactly which foods are adding to it and exactly what to eat instead. The choice, from this moment forward, is yours. The science of how these 7 worst foods interact with the specific medications that most adults with arthritis take deserves explicit discussion, because the food-drug interactions in arthritis management represent some of the most clinically significant and most underappreciated combinations in the dietary management of this condition. Refined sugar and NSAIDs. The blood glucose spikes produced by refined sugar consumption activate the same inflammatory pathways that NSAIDs are designed to suppress. When a patient takes naproxen or meloxicam to reduce joint inflammation, and then consumes a high-sugar meal, they are simultaneously suppressing and stimulating the inflammatory cascade, working against the medication's intended effect. The reduced efficacy of NSAID therapy in patients with high sugar diets is not well studied as a pharmacological phenomenon, but the mechanistic basis for antagonistic interaction is clear and clinically relevant. Omega-6 vegetable oils and methotrexate. The systemic pro-inflammatory environment created by chronic omega-6 excess may reduce the efficacy of methotrexate and other conventional ARDS in rheumatoid arthritis patients by maintaining the inflammatory cytokine production that these drugs are designed to suppress. Research has documented that dietary omega-3 fatty acid supplementation improves the efficacy of methotrexate through its complementary anti-inflammatory mechanism, the mirror of which suggests that the omega-6 overload in patients consuming these oils may have the opposite effect. Alcohol and multiple arthritis medications. We covered the triple whammy interaction of NSAIDs, diuretics, and ACE inhibitors in our medication video, and alcohol adds another layer of concern in this context. Alcohol is itself a diuretic-producing volume depletion that compounds the renal stress of the NSAID diuretic ACE inhibitor combination. Alcohol also increases the hepatotoxicity risk of methotrexate, which is why rheumatology guidelines universally recommend minimal to no alcohol consumption in patients taking this medication. For adults on biologic ARDS, alcohol's immunosuppressive effects add to the already increased infection risk of biologic therapy. The interaction between the 6 worst food and arthritis medications is therefore multidimensional and extends well beyond the joint inflammation mechanism we described. The gut microbiome implications of the 7 worst foods connect to a dimension of arthritis management that the research has increasingly validated over the past decade. The gut-joint axis, the bidirectional communication between the gut microbiome and the inflammatory environment of joint tissue that operates through the immune cells, short-chain fatty acids, and bacterial metabolites that the microbiome produces. The specific gut microbiome changes produced by the 7 worst foods collectively represent a comprehensive disruption of the anti-inflammatory microbiome architecture that healthy joint function depends on. Refined sugar selectively feeds fusobacteria and proteobacteria pro-inflammatory species, while depleting bifidobacterium and lactobacillus. Refined flour reduces dietary fiber intake that the butyrate-producing firmicutes require for their fermentation activity. Processed red meat promotes the sulfur-reducing bacteria that produce inflammatory hydrogen sulfide. Omega-6 oils shift the lipid environment of the intestinal mucosa toward an inflammatory composition that increases intestinal permeability. Alcohol depletes multiple beneficial bacterial species simultaneously. Saturated fat from non-fermented dairy activates intestinal inflammatory pathways through toll-like receptor 4. And ultra-processed food emulsifiers directly disrupt the mucosal barrier through the mechanism we described from the Nature study. The cumulative effect of all 7 worst foods on the gut microbiome is therefore a comprehensive pro-inflammatory microbiome shift that amplifies systemic inflammation through every available pathway of the gut-joint axis simultaneously. This is why the most impressive dietary intervention studies in arthritis, those showing the greatest reductions in inflammatory markers and clinical symptoms, are the ones that make comprehensive dietary changes rather than eliminating individual foods. The microbiome responds most dramatically to comprehensive dietary pattern change rather than to the removal of individual components. The positive flip side of this gut-joint axis understanding is equally important. The replacement foods we have recommended for each of the 7 worst foods are not simply individually less inflammatory, they are collectively microbiome supportive in ways that create a positive inflammatory environment that amplifies their individual benefits. The dark berries and whole grains provide prebiotic fiber that feeds butyrate-producing firmicutes. The fatty fish and olive oil support the anti-inflammatory lipid environment of the intestinal mucosa. The fermented dairy products add probiotic bacteria to the microbiome. The legumes provide resistant starch that specifically supports bifidobacterium. And the polyphenols in every replacement food, from the anthocyanins in berries to the oleocanthal in olive oil to the flavonols in dark chocolate, act as prebiotics for the beneficial bacterial species that produce anti-inflammatory metabolites. This microbiome-mediated amplification of the replacement food's anti-inflammatory effects is one of the most compelling arguments for the comprehensive dietary replacement approach we have described, and one of the most underappreciated dimensions of why dietary change in arthritis produces benefits that extend well beyond the direct anti-inflammatory effects of the individual foods. For adults, implementing the 7-food replacement strategy alongside the complete osteoarthritis management program we have built across this series: the exercise program, the anti-inflammatory supplements, the proven vitamins, the topical medications, the before-bed fruit protocol. The dietary changes provide the systemic foundation on which every other intervention works most effectively. The exercise program produces greater anti-inflammatory effects in a body with a less inflammatory dietary baseline. The omega-3 and curcumin supplements achieve higher effective tissue concentrations in a gut microbiome that is absorbing and metabolizing them optimally. The vitamin D provides more complete immunomodulatory effects when the inflammatory burden that the diet is creating is lower. And the topical diclofenac manages less persistent pain when the systemic inflammatory load that the diet is generating is reduced. This is the integrated view of the 7-food replacement strategy, not as a standalone dietary intervention, but as the anti-inflammatory foundation on which the complete arthritis management program achieves its maximum effect. Optimal foundation. Maximum therapeutic effect. The best possible outcomes for joints that deserve the most comprehensive care available. The practical barrier most commonly encountered when adults with arthritis try to implement this 7-food replacement strategy is not knowledge, it is the food environment they inhabit daily, and the social and cultural dimensions of eating that make dietary change far more complex than simply knowing what to eat differently. Most adults with arthritis do not prepare every meal they consume. They eat in restaurants where omega-6 vegetable oils are the universal cooking fat. They attend social events where refined flour products and processed meats are the primary offerings. They have family members who prefer white rice and bread and who react to dietary changes as personal rejection. They reach for convenience foods when time is short and energy is low, and convenience foods are overwhelmingly ultra-processed. And they live in a food environment that is designed, at the commercial level, to maximize the appeal of exactly the 7 foods on our worst list. Acknowledging these barriers honestly rather than pretending that dietary change is simply a matter of individual decision is the first step toward making the replacements practical and sustainable. A few specific strategies that research in dietary behavior change has found most effective for making comprehensive dietary replacement durable rather than temporary. The replacement approach rather than the elimination approach. Instead of thinking about what you cannot have, think about what you are going to eat instead. Each meal, the goal is to ensure that the replacement food is present and appealing before the worst food becomes the default. Dark berries in the refrigerator ready to reach for makes the refined sugar snack unnecessary rather than merely prohibited. Quality olive oil on the counter makes reaching for vegetable oil unlikely rather than willfully avoided. The batch preparation strategy, preparing large batches of the replacement foods, a week's worth of steel-cut oats cooked on Sunday, a tart cherry juice supply in the refrigerator. A bowl of washed mixed berries accessible in the front of the refrigerator reduces the friction between intention and action at the moments when time pressure and decision fatigue make the worst food choices most attractive. The family communication approach, explicitly communicating the health reason for the dietary changes specifically and scientifically. The way this video has communicated them to family members and regular dining companions reduces the social friction of dietary change and often generates support rather than resistance. The restaurant navigation strategy at restaurants. The most reliably available replacement approach is requesting olive oil as the cooking fat for any dish that would otherwise be cooked in vegetable oil. Choosing grilled or baked fish and lean poultry over processed meat products. Requesting sauces and dressings on the side, where they can be used in small amounts or replaced with olive oil and lemon. And selecting naturally sweetened or fruit-based dessert options over pastries and cream-based sweets. The science of dietary habit formation suggests that the 4-12-week period required for inflammatory markers to show meaningful improvement from dietary change corresponds approximately to the period required for new dietary patterns to begin feeling automatic rather than effortful, the point at which the replacement foods have become the new normal rather than the disciplined alternative. The initial weeks are the most challenging. Every subsequent week becomes easier as the new patterns consolidate into automatic choices. This 7-food replacement strategy, implemented consistently over the 12 weeks that the research on dietary anti-inflammatory interventions identifies as the period of most significant inflammatory marker improvement, represents one of the most impactful single interventions available to adults with arthritis who are not yet making comprehensive dietary changes alongside their other management strategies. It requires no prescription. It requires no physician appointment. It requires no special equipment or preparation. It requires only the knowledge of which foods to replace, the specific replacements to put in their place, and the 12 weeks of consistent practice that allows the biology and the habit to both consolidate into the sustained anti-inflammatory benefit that the research documents. You have the knowledge. The replacements are specific. The science is clear. The 12 weeks start with your next meal. If this video gave you the specific, evidence-based, food-by-food replacement guide for arthritis inflammation that you have been looking for, please support this channel. Hit the like button right now. Subscribe if you have not already. Share this video with someone managing arthritis who wants to know exactly what foods are making their inflammation worse. And leave a comment below. Tell us which of the 7 worst foods is the hardest for you to give up, and which replacement you are going to try first. We read every comment. Thank you so much for watching. See you in the next one.